Welcome to the Reprofiles, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Reprofiles.
Infertility, injustice, and all things nobody warned you about. Hello, it's getting hot in here. No, I'm not singing, Nelly.
Please don't sing anybody that's copyrighted. Once again, lawsuits are not in our measly budget. But today's hot topic is menopause.
Oh, yeah. I got my fan going on. I'm ready to go because we're talking about menopause, the change of life. When I was a kid, I heard that phrase a lot and I'm like, what does that mean? I don't even know what it meant. I think nowadays when I think back on it, I think women are just like, we just smiled and we're like, I'm fine. But inside, we're silently seething.
Absolutely. I was just having this conversation with a group of folks last night about, and we may have talked about this on an earlier episode, but how when you start your period, or at least when we did, we legitimately sometimes thought we were dying.
Yeah.
What else is a young child to think when they start gushing blood out of their bottom? Oh yeah, this is that thing. I think it's
Yeah.
very fascinating that also translates. It translated through to sex ed when we had that conversation, and I think it translates through to this as well in terms of societal norms and how those norms really lay the foundation of what we are going to grow up thinking about certain things. So today's topic being menopause, let's start with the definition. So menopause is medically defined as 12 consecutive months without a menstrual period that's not caused by another condition. So there are other conditions that can play into it. The most general definition is 12 consecutive months without a menstrual period.
And
I
I
have that
say,
right.
I say Alleluia, because as we had determined earlier in our podcasting, I started my period at age 9. So yes, please sign me up. But this whole definition really got me going because, okay, I was on birth control pills because I didn't want to get a period. I was tired of it. I was over it, and they were becoming very unpredictable, the perimenopause type of thing. They were becoming unpredictable, extremely heavy. Like I had to go get new scrubs to get through the day kind of heavy. And I've never had that, even growing up. So I went back on birth control pills to stop it. So that was great. Loved it. And then I passed age 50.
You're older than 50?
I'm actually 30, but when I was 50, so I passed 50, I thought,
Wait,
hey,
wait,
maybe
wait. Hold on. Pause, real talk time. Are you really older than 50?
I'm 51.
Stop it right now.
I am.
I thought you were younger than me and I'm 42. Okay, continue.
Okay.
Not fair. I need your skincare regimen. What?
Okay.
Okay, sorry,
Yeah.
please.
So, yeah, when I passed age 50, I was like, well, let's just kind of see where we're at. Maybe I'm there, maybe at menopause. And I stopped taking the birth control pill last November. And for 7.5 months, I was so happy because I didn't get my period. And then I got my period in June. And I was like, WTF, 7.5 months? Do you know what that means? That means my year restarts. I have to
I know.
restart.
That's
all over
literally one
again.
of the cruelest parts of having female anatomy and hormones is you had to start right back over Candyland style, back to the bottom.
That it's like, do not pass go, do not collect $200, go straight to jail, monopoly wise. I was
That's
so
not
mad.
okay. So now
It was
where are you?
painful.
Do you mind sharing with the viewers and listeners where we are on our read journey toward the 12-month timeline?
Yeah, so TMI, I'm back to what, 2 months now.
Woo!
So
All right,
yeah,
2
now
months.
I got eight months. There's 10 months in the year. There's
You know,
12.
nowadays in today's climate, Anne-Marie, I think most folks would probably agree with us that there's a lot happening in a very short period of time. So it's okay that
Yeah.
there's the confusion. But I actually am
Yeah.
sort of excited to go through this because the hardest part of menopause is the perimenopause.
Ugh.
because
Yeah.
you're like, it's why this transition or is of perimenopause can feel confusing because your cycles will start getting unpredictable, and then sometimes they'll temporarily be predictable again. Like there again, you just kind of start over. Or symptoms can start. Somebody was asking me last night, I have to ask you, are you a women's health nurse? It's funny when people find that out because then all of a sudden, like all the gloves are off to ask anything.
Questions.
And I'm like,
Lot.
yeah, ask me anything. I'm like, I went through the trenches so I could answer your questions. So she said, how do I know? And I was like, listen, when you start having all kinds of unpleasant symptoms that everyone wants to mansplain away, that is
Mhm.
a great, and you're over 40, that is
Mhm.
a great hint that you are moving in that direction. But perimenopause itself can stretch on for years.
Years.
And this literally starts on average around mid 40s and can continue through the 50s. So we're talking potentially 20 years.
No, it's not right, man. Not right. I think, what's interesting to me is that, it's more out there, right? It's more in the open. I think we're just this generation we're tired of hiding things, like our parents' generation are more like, I was in the hospital, but I didn't want to worry you. So they didn't tell us. And we're
Yeah,
like, what? What are you
yeah. I
talking
was on life
about?
support. It was only like a week and a half. I didn't want you to
Yeah,
worry. Yeah,
I didn't want you to worry, you didn't wanna bother anybody, but I'm fine now, I'm home now. What? So, I think now we're in a generation that's like, "You know what? Let's talk about everything."
yeah. Yeah, absolutely. I mean, ultimately, I think this goes for a lot of different things, but I was thinking through this the other day with regard to like our emotions even and how common it is for us to apologize for these things, but only because that was the construct through which we were raised. Not good or bad. It
Right.
just was.
Yeah.
So, and I think Gen X, ladies are so over that and we want information and we want to be able to talk about things because it's unnatural to suffer and look around and be like, and I know that we both in the perimenopause thing, but we can't say anything about it. Right. Like, and we want to be active members of the We Do Not Care Club. So
Mhm.
if you are listening and you are watching and you are not familiar, and this is an unpaid plug. We just happen to love you, Melanie. If you ever want to be on our show, welcome. But Melanie Sanders rose to internet stardom by founding what's called the We Do Not Care Club. And I am an active recruiter for the We Do Not Care Club. And
Got
what
me
it
started.
is, how it started was she was like, guess what? I'm in perimenopause, and here are some things I don't care about anymore. We don't care about this. We don't care about appearances. We don't care about trying to put on the face. Like one of my favorite things she says is, we do not care if you're unhappy that we put your drawers back in your drawers inside out. If that is how you gave them to us, that is how you will receive them back. But she is just exactly what so many of us that are like either, early to mid 30s where women are kind of like, they know that that's coming. And then there's the group of us that are kind of in the middle of it. And then there's the badasses that have survived it. And we all want to talk about it.
Let's just
And we don't want
talk
to be
about
bothered
it.
with nonsense and other shenanigans.
Absolutely not. The internet is full of information and some of it's great and funny and humorous and others not so great and it's not, the greatest advice. Talking about experiences is important so that we can all kind of share our experiences and know, hey, that's happening to you too. Oh my gosh, that's totally happened to me. We would just want to know we're not alone, that what we're experiencing is not weird. It's not a shameful thing. It's
Yeah,
just a natural
it just
thing that
is.
so, now we have all these articles on menopause and how to get through it. And we have all of these healthcare sites that are like, picking up on it. All the major insurance company websites, they all have stuff about menopause, social media, influencers, all of that. And I'm gonna admit something. So I started getting AARP, that's the formerly known as the American Association of Retired Persons. Okay, I started getting their mail a few years ago. and I would throw it across the room or straight into the garbage. And my my husband is 18 months younger than me, and he thinks this is hilarious. But no jokes. I actually get discounts with my $15 per year membership. That's right. I'm eating the Blue Plate special. Anyway, so now that I've sound so old, but I'm just saying that, like, everybody's embracing it. There are
Yeah,
actually articles on AARP about menopause and, "Hey, let's get through it and let's talk about it and let's embrace it," and,
for sure. Even
then give
like,
'em my discount.
and then give him a discount. Yeah, actually, my it's so funny that you brought that up because my husband, um, he's dealing with getting older and, me having had a lot of medical problems in life, I just kind of roll with like really big diagnoses with like, cool, we're doing that now. We're adding that to this number 27. Awesome. Meanwhile, when somebody who has had the good fortune of being really healthy the majority of their life starts to age a bit and run into things like, his eyesight and like, no, no, it's fine. Meanwhile, like we're out at dinner and he's got the menu with his phone light. And I'm like, you want some reading glasses? And then we were joking as well this morning about, colonoscopy age. And
Mhm.
we were literally having a conversation about, the kits that you can order in the mail. I don't wanna use their name. Again, lawsuits, no thank you. But and how, they're very particular about the method in which you provide said sample in the mail, and it was like, you're getting older when you're mailing your stool off to some, lab
Yeah,
in the Midwest. Absolutely. I mean, but back my point there, so even our male counterparts, they need room to
yeah,
talk about some of their stuff too. They've got prostate issues. They've got all kinds,
yeah.
these are natural parts of aging
It
that if we
just
were to just embrace and connect on, I think we would have more respect for the human condition overall.
yes,
But back to
yeah.
menopause.
Yeah,
Back to
so
menopause.
you know, we have this long list of symptoms like hot flashes and night sweats, joy, vaginal dryness, painful sex, sleep disruption, dry eyes, mood changes, and of course, brain fog. This all sounds so much like fun.
Where do I sign up? What was that menopause doc?
Yeah, can
I
you
can't
just
wait
sign
to
me up for
be
this?
my card carrying member.
Yeah, it's so fun, let me tell you. But, personally, I rely on fans. I have a fan over here, I have my ceiling fan, and of course, I have my personal fan right here. So I have a lot of fans going on and maybe some lube and a little sense of humor, and that's how I survive.
I also have multiple fans, do have fans will travel.
I
And
think it's
yes, you
because
make such a great point.
we live in, like, 2 of the hottest states in the country, so maybe
Yeah,
that's the
no,
problem.
absolutely. If you've never listened to us before, I'm in Arizona and AnnMarie is in Florida. And so our hearts go out to those of you who are in the hotter states and having to deal with these symptoms because it is not easy. But there again, the ability to talk openly about it at our scouts meeting last night, we were, all the moms and I were standing around like looking at each other like, oh my gosh, it's so hot. But beyond even the like, well, in part of what makes the sleep part hard is the heat, intolerance. But I
Mhm.
think something that's sort of under accepted or talked about is the sleep problems that come with the change and how disrupted sleep drives cognitive fog. It can worsen anxiety. It can lower quality of life. So those things are just from the sleep part.
Yeah. Do you wanna see what I do at 3 o'clock in the morning? I just go through my phone. I'm looking at my phone all 3 o'clock in the morning because I can't go back to sleep.
Yep. Yep.
Unfortunately, these symptoms, they're not short-lived, and for many women, like, these vasomotor symptoms can last, like you were saying, 7 to 10 years, and that's why we need better solutions than just eat better, drink some water, we need something more than that.
For sure, for sure. Because when we say things like eat better and drink more water, we communicate that it is your fault. Because if you only ate better and drank more water, this would not have happened. And that's just not even anywhere near the truth. What we need to be saying is that these are normal things. Eating better and drinking more water can help improve symptoms, whatever comes next. But leading with us, I mean, and if women, as women, if we had a dollar for every time we were told it was just eat better, sleep more, you're too overweight, or you're too this, or you're too that, or whatever. Instead of affirming that, okay, you're 42, you're coming in here telling me that you're sweating at odd hours, that you're irritable, you're having trouble sleeping. That is textbook, let's work you up for perimenopause and see how we can support you. So if we talk, we are nerdy around here at the Reprofiles podcast. So we do like to do science sometimes. Bear with us. So let's talk about the hormones and the
Uh-huh.
sort of the juxtaposition, or how if your hormones were a soap opera, sort of the different roles they might play. So here's what's happening inside. In your brain, the pituitary gland sends out a signal, and that signal is in the form of a hormone called follicle stimulating hormone. And that signal, it exists in the pituitary of the male and the female, and it is a messenger. It says, go to the gonads, either the ovaries or the testes, and produce your gametes, aka your oocytes or your eggs, and then your sperm, right? So it's the messenger that goes and says, all right, time to grow a follicle in the ovaries case.
Yeah. Yeah, and then what happens in, like, perimenopause, menopause is the ovaries are like, "Nah, I don't feel like doing it right now. Don't feel like it." So, then the pituitary goes, "Excuse me, you're gonna get some more FSH coming your way."
Because you must not be getting the message.
Yeah, then the ovary was like, "Yeah, I'm busy watching Netflix. You can take a hike." And then the pituitary, he shouts even louder and says, "You are going to create a follicle!" And then this is just a standoff. It's a constant back and forth thing, and it just leads to lower estrogen, progesterone, and it just drives this wonderful storm of symptoms.
Yeah, no, that's the crux, right, of the science piece, right? Because it is. The ovaries are like, I'm tired. We've been doing this whole thing since you started your period at age 9, AnnMarie. Like, we're kind of like ready to retire. But it takes them a second to get the message. A second, by a second, we mean like the 7 to 10 years of menopause, of perimenopause. But the key there is that kind of back and forth between the brain attempting to stimulate the gonads and its failure to do so, and what that negative feedback loop looks like. The lower estrogen, the lower progesterone is what causes ultimately the long-term risks like osteoporosis, cardiovascular disease, skin, urogenital changes. When we think about our ancestors and our female ancestors who lived much shorter lives, they weren't facing as many consequences from menopause because they weren't living long and I mean they weren't outliving their ovaries in the way that we are today. But because we are outliving our ovaries and we are having all of this drop off in hormones, that's what's putting women right off the bat at an increased risk of preventable diseases.
Yeah, I mean, those by the way, those changes, they don't sound bad. They sound horrible.
Or
So, here's my thing. If menopause was manopause, okay? All right, go take a
I'm
little
going
journey with me. Take a journey with me. So, if
menopause.
if men's heart attack risks went up, if their cholesterol started going sky high, and if their bodies just naturally started to have arteries hardening, their bones becoming brittle, there would be millions. No, there would be billions into research of to find out why and how to prevent these things from happening.
You are so right. I mean, even if you dig under the hood in terms of how medical research is done, how it is disproportionately done on men, not women, drugs that have gone through FDA clearances that have happened without ever having a woman be a part of a study. And so it's a really salient point in my book that if any of these things were happening to the men around us, it would be like the forefront thing that, like going to the moon, we're going to cure this
Menopause.
menopause because menopause, I can't be a man with menopause, right? So
Yeah.
we would totally, we would see it be treated so much differently. I think that's without getting too deeper philosophical, but that's part of the disappointing part about where things are right now is that there is this inequity that exists all over, not just between genders, but between races, between classes, I mean, there's just all of these buckets that we're looking to put people in, and which means then keep other people out.
Mhm.
Whereas if we funded research for things like the maternal mortality crisis or even the infant mortality crisis is starting to crop up in some of the southern, more red states. I want to say a story, please don't quote me on it, but it was maybe Missouri is noting like the highest rates of infant mortality in 10 more or more years. And if we really put the dollars into it to study it in a holistic way that included everybody, right? Because to only
Yeah.
study these things on, a certain gender or certain class or whatever is sort of eugenics, right? I mean, you're just excluding a certain group of people. Anyway, like I said, I don't want to go too tangential on that, but you really got me with menopause. I enjoyed that
Yeah.
journey with you.
Oh, you're welcome. And now we're back. So,
We're back.
and we're back. Well, I think that some of these, we do have treatments, right? We do have some. So, some of
Yes.
the evidence-based treatments that we have, including hormone replacement therapy, or also known as HRT. Hey, more acronyms. Remember last week we had acronyms. This week we got more.
There's going to be a test at some point. There's going to be like
Yeah, at
the
the
Ultimate
end of the
Reprofiles
year.
podcast fan club, and you'll get status if you can correctly identify 8 out of the 10 acronyms. I feel something very fun coming along there.
Yes.
Continue.
I like that. Well, HRT is the gold standard for hot flashes and genitourinary symptoms for women under 60 within 10 years of menopause. And usually in those cases, the benefits outweigh the risk.
Yeah. And let me just add this in here. I just had this thought off the cuff, but we this show is not a substitute for medical advice. Please don't take it as that. We are nurses, but we are giving you our experiences, what we're hearing, what we're reading, what we're seeing. But the ultimate thing that we want you to always remember is that this is something really important that we want to empower you to be able to go to your doctor and talk about. So I just wanted to add that in there. We should, speaking of lawsuits, we should probably add some sort of disclaimer at some point. But again, we know our place and we want you to know, this information, but to also know that the key is to take that to your doctor because hormone therapy is not right for everyone. I myself have one of the risks, and that is not a history of stroke, but a high risk of stroke from migraine disorder. So we have to be more careful with folks like myself with certain issues like migraines or certain cancers or a history of stroke or clotting disorders or there are different reasons that hormone replacement therapy may not be a good choice for you and or it needs to be very well tweaked to your situation and the diseases that you have going on. So,
Absolutely.
but
Yeah, there
ultimately ask your doctor because at the end of the day, hormone replacement therapy doesn't typically need to be taken the rest of your life.
huh?
But there again, that's a topic to discuss with your healthcare provider. And a good healthcare provider will do lab work on you, most likely, every so often to check the levels and to optimize the levels. And that's what a good provider should be doing. A good provider shouldn't be sending you with a prescription for testosterone and be like, see you in a year, because that's not how we really truly help tailor the treatment to your symptoms.
Absolutely. And there are non-hormonal options out there too. There are medications out there that help alleviate symptoms. And those are something that you can go into as well if you're not comfortable with, HRT. That is totally fine as well. And lifestyle does count. Exercise, balanced diet, stress reduction. Structured sleep routines, things like that. They can lay the groundwork for it. But I think it comes down to quality of life. If you want to try to get kind of go ahead from your provider, then go for it. Do HRT. We're not saying don't do it. We're not saying do it. But if it improves the quality of life, that's great. If not, you stop or you don't do it. The
Yeah.
thing is that you are being the decision maker and you're being your own advocate in this important matter of your reproductive life. And this
Yeah.
is part of your reproductive life.
Yep. And the solutions aren't one size fits all either. And that's what we're trying to
Exactly.
help you understand is that because your symptom profile, going through this process may not be the same. You may struggle more with vaginal dryness than another person, or, there's different manifestations, I guess you could say, of how what your symptom profile is going to look like, and how your maternal or female ancestors went through menopause has some play into your onset, what it's like, those sorts of things. But what's important to overarchingly point out is that it is about treating and supporting symptoms, symptom relief until the change, so to speak, is complete, and then you're looking at
The
protecting
change.
the change. And then, local therapy matters too, or topical therapy. So there's, again, whatever bothers you, that is what you lead with and
Mhm.
allow your provider to say, because I mean, for the overarching constellation of menopause and perimenopausal symptoms, there are supportive measures for pretty much all of them. So, in terms of supporting the symptoms. So, whatever is the thing that is most bothersome for you is going to be what determines some of the interventions that your provider might offer.
Yeah. Yeah. And I think it's important that we don't get into these very similar to like the mommy wars where you're stay at home or oh you work, but it could be the same thing with HRT, like, oh, you're taking HRT, like and then like, oh, you're not. You know what? Let's just be done with that and
There
just be like,
again,
oh
us, them, you, me, if I'm here, I'm not there. Whereas if we actually just take one step towards each other, we find that, oh, wow, you did that. You had that happened to you too. Like, you really, all of a sudden, you're like, okay, we have a lot more in common than we thought.
yeah. Yeah. All right. So that's kind of like on the whole treatment thing, but Elizabeth, I got to tell you about one thing that has been really bothering me. It's brain fog. And it's for real. Like I will literally walk into another room to get something, walk into that room and literally forget, why am I in here? And I'm like, okay, I'm not I don't have dementia, at least I don't think I do. So it's gotta be something. So then, I go back into the room that I originally is. Of course I remember and I go back in and get whatever I need to do. But this happens like all the time and it's driving me insane. I'm also really terrible at remembering names, Edith. I mean, Elizabeth. I was already really bad at remembering names, but now I'm even worse. And my vocabulary is just full of whatchamacallit and thingamabobs and what's her name and what's his name. I
And
just
that thing.
that thing that, I
What's your
use and
name?
it's very frustrating. And if anybody's a fan of The Office, which everybody knows I am, it's like Michael Scott when he talks about how he starts a conversation and he doesn't know what direction it's going. And it's kind of like an improv
Improv.
conversation. And he calls it improvisation, and that's literally me because at the beginning of what I'm gonna say, I'm like, totally have this point, and I start talking, and then I lose it. I'm like, "What was I talking about? Oh my gosh, what were we talking about?"
This
And
Anne
then I
Marie,
just
the
I try to
solidarity
find
that
it.
I feel with you right now, hearing you say that, the solidarity that I feel is so affirming, because for me, it's definitely the walking in and out of rooms thing.
Yeah.
But if you know me, you know I'm a talker, and I like to storytell. It's something that I enjoy. Now, in the change, I will be mid-story, like, I'm at the peak part of the story, and all of a sudden, I'm like, "What was I saying?" Gone.
Yes, gosh.
Completely gone, and I'm mortified because I'm like, I was right at the best part, like, how did I forget? And it is the brain fog is so
Uh,
frustrating, and it's such a shared experience for so many people. Fortunately, evidence does show that these cognitive dips are often temporary, and so that gives me a little bit of hope and I hope that that resolves itself before I become of an age that I then start forgetting things, and therefore it's a wash. So,
yeah.
we did say earlier, we talk about it again, but, this idea that I think a lot of folks have a myth that you have to be on hormones forever. And the truth really is, once again, that whatever method you choose has to really be individualized to your symptom profile,
Mhm.
and really reassessed on a regular basis to ensure, because also over time your symptom profile will change. So it's like, you remember having toddlers or even a baby, an infant, right? And just when you get like your groove with like one thing, it
Huh?
changes all of a sudden. You're not battling over shoes anymore. You're battling over, who knows what. And the game is always changing. And I think that it's really important to let you all know that it is normal for it to be that way with this process. That today, what is the struggle might not be quite the struggle in a month or two, and that things do change. And that's where going back and reassessing regularly with your provider can help you make sure that you are always kind of staying ahead of what the thing that is most bothersome.
Exactly. There's that, other myth that we touched upon earlier is that, HRT is universally dangerous. So, we do have evidence-based practices show that it is safe and effective for the right women at the right time.
Yeah. Yeah. I mean, and then there is the snake oil market, and
Yeah.
that's, we unfortunately can't escape that. And so I think that because there is stigma around talking about some of the symptoms that might pop up during this period of time, I think folks are a little bit more likely to turn to a private source of help, maybe than to go to a healthcare provider and divulge that information. But unfortunately, what that leads to is overpriced creams that have no clinical evidence whatsoever to make any difference in the thing that they're claiming, to miracle supplements who do the same. And many products they prey on the fact that these symptoms are really distressing. Hot
Mhm.
flashes are super distressing. There's a moment in time, at least for me, where I don't know, maybe 30, 45 seconds. I mean, it's somewhat reminiscent of contractions in labor. There's a minute or two there where it's really, really, really uncomfortable and scary. And so I think you see a lot of products that do prey on women's symptoms without evidence because they have such a captive audience, right? They want, this consumer wants anything. You
Mhm.
hear people say, "I'd stand on my head if it worked," right?
Yeah.
So,
Yeah. Yeah, and so, I mean, I guess it comes down to, stick with the FDA approved therapies or options, just something that your clinician, your provider recommends. Snake oil salespeople have been around thousands of years. Like we could go back thousands of years and they're still going to be like, oh, hey, try this, but wait, there's more. It just talk to your provider, talk to your clinician. That's the best way to go.
absolutely. And that's not to suggest, by the way, that, I'm certainly not saying go for something that's not FDA approved, but I think that there is always value in looking to see the breadth of options, which can
Hmm.
sometimes be, supplements and things like that that aren't just some flash in the pan thing, but that have, and there again, that would be something. I know my naturopath is an absolute angel from above, and
Hmm.
she just does such an amazing job. When I come in, she's always like, "What are your goals? What are you struggling with? What are your goals?" And I'm like, "Man, if every provider led with, what are your goals? What are your goals? Like, or what are you struggling with?" Because, like I
It's
said,
really
sometimes it's
interesting.
hot flashes and other times it's other things. So,
Yeah.
but when menopause like symptoms start appearing before age 40, so this isn't really something that we've touched on yet, but this is really, really, really important because I think that sometimes, even in women in their early 20s, their periods will stop and they think that can happen. Periods, can be irregular. They'll go 2 years without a period and then they'll start trying to get pregnant and discover that they have premature ovarian insufficiency. So, when menopause like symptoms start appearing before age 40, so if you're younger than 40 and you're having hot flashes, night sweats, mood swings, irritability, insomnia, any of those things kind of that we've talked about, it's really, really critical that you seek timely evaluation because at that point, because it's early onset, if you've still got family building goals, and even if you don't have family building goals, we're going to need to support you no matter which way you want to go, but you need to have the options.
Yep. Yep. And sometimes with some women with POI, oh hey, another acronym.
Whoop,
They often
POI.
benefit from HRT until around the average age of natural menopause. So it's there to protect their bones, their heart health, their quality of life. These cases when they would come in to the fertility clinic, like since we obviously that's where we come from, would always be the hardest cases to talk about.
Yeah. Yeah. And I think there again, it's easy to brush it off as something else. but
Yeah.
it's so critical. It's such critical information for young people to understand what is normal, what is abnormal, when do I get help, right?
Right.
And
Yeah.
so managing menopause effectively requires a pretty structured plan. Again, because it's so different for everybody, you need to really start by tracking your symptoms
Mhm.
and really getting a sense of, because sometimes the most distressing ones aren't necessarily the ones that are happening most frequently. So when you start to take inventory of kind of, okay, these are the things that feel off and here's what's going on, then, with your provider, you essentially you review the risks, the benefits, the alternatives. You discuss systemic hormonal options versus non-hormonal options, and then continue to come back and reassess regularly against your ongoing tracking of your symptoms. And then there again, the risks, because those risks do change over time.
Absolutely. And it's also important to talk with your partner. If sex is becoming painful or if your libido has changed, you should be able to have an open conversation with your partner. Okay, I want intimacy, but my body's a little different now. Please, be patient with me. Maybe
Yeah.
you both have a sense of humor and maybe some good lube. All of those things can help. It's
No,
important to have an open relationship with your partner and
there
open as
again,
in open conversation
thank you for the
with that's what I'm
clarification there.
talking about.
I imagine some of our listeners may have wondered if that was a
Yeah.
slip of the tongue. But yes, there did it again. Moving on. Yes. So when we kind of package this whole thing up, it's really important to recognize that hormone therapy can be really safe for many women, but not for everybody. And so, for a lot of different reasons, non hormonal therapies exist, and some lifestyle changes can be helpful in providing important support. So, understanding that a lot of what you hear about most things, I think, along the reproductive health spectrum. So, periods starting, birds and the bees, pretty much everything we talk about on the Reprofiles podcast is something that has traditionally been kind of shrouded in shame. And so here again with a partner, just being like, being able to openly say, like, this is painful and
Mhm.
I need you to bear with me, right? Because a good
Yeah.
partnership, one partner should not expect the other partner to, sacrifice their body, put themselves in pain and things like that. So, but many people, I think they suffer with that in silence, or they it's painful and they just happens because they don't know how to be open. So
Yeah,
there
their
again,
partner
we're
doesn't even know. Their partner
yeah,
thinking, "Oh, this is, what we normally do. Everything's fine," but, it's not.
yeah, everything's not fine.
Yeah, absolutely. And, just don't forget the brain fog. Don't forget that. And the mood changes. And just because you have those doesn't mean that you're broken. Believe me, I know.
I
They
love
are a
that.
part of
I
they're
used to
part of
tell
that
our
whole
fertility
transition,
patients
yes.
that. I would say to our fertility patients, actually more often than that to them, but to their partner, I would say your partner's gonna change for a little bit on these meds, because fertility meds are lots of hormones. And so fertility meds can actually cause a lot of the symptoms that we've been discussing over the course of this episode.
Yeah.
So as if it's not unfair already to have to go through all of that, but then to have a lot of really negative symptoms that pop up. And so I would tell patients and their partners that your partner's not going to be him or herself for a little bit, and that's okay, and they need you to just be supportive, and it doesn't need to make sense to you. It's just being there with them and giving them space to talk about it, and being the one that's like, oh, you need an Epsom salt bath, I'll be right back, let me run to the store. But it requires, again, we have to keep talking. We have to keep sharing our truth, and we have to keep refusing to hide what women have been told for too long to hide. And it's, again, all the things we talk about: periods, sex, labor and delivery, perimenopause, menopause, infertility, premature ovarian failure, premature PCOS, all the things, endometriosis. These are all things that women have been told to hide for too long. And so we're ripping the curtain open week
Mhm.
after week
Yep.
so that next generation of women aren't like, what the hell's the change?
Yeah. What is that? I don't know. But yeah, so I would say to our dear listeners to share your story with us if you'd like. We don't have to use your name, but we would like to, hear from you and let us know. Comment, email, to us. We just want to hear what else is going on out there.
Yeah, you can send your story to us at the reprofiles podcast at gmail.com, or you can connect with either of us on our various social medias. But please know that this is a topic we care really deep. All of these topics we bring you, we care really deeply about. I have over the years many times, and AnnMarie, I'm sure you've done the same. I've had, random Facebook groups where people reach out privately and go, "Oh, I hear you're a fertility nurse. Can I ask you a question?" And it's one of what I consider to be life's greatest privileges to be able to be like, you can ask me anything. Like, I
Yeah,
have this knowledge. Why wouldn't I share it with you?
absolutely.
All right. Well, we
Yeah.
will see you next week. And until
Yes.
then, keep being open and honest, and we'll see you next week.
See you then.